Well, thank you so much. And thank you all for joining us for this really important conversation. And I want to thank all of my colleagues for their incredible leadership in fighting to make sure every person in our country can get the birth control and reproductive health care they need. And I'm really glad today to be joined with Congresswoman Pressley on the anniversary of Griswold versus Connecticut, by the way, the landmark Supreme Court case that affirmed the right to contraception, to talk about our legislation to make sure that everyone can find and afford over-the-counter birth control. And I'm really grateful for Congresswoman Ocasio-Cortez, Congressman Bera, Senator Hirono, and Senator Cortez Masto's leadership on this bill as well. As everyone knows, right now, the Supreme Court is preparing to overturn Roe v. Wade. And Republicans are weeks away from fulfilling their decades-long goal of ending a constitutional right to abortion. It is cruel and it is outrageous. And mark my words, Republican lawmakers here in Congress and in states across our country are not going to stop at abortion. They are coming after your birth control too. The reality is that Republicans are working around the clock to make it harder to get reproductive health care that makes sure everyone has full control of their own bodies and can plan if and when to have a family on their own terms. My Republican colleagues in the Senate just tried to reinstate a Trump-era rule that would wreck the Title X family planning program and the tightest budgets to get the birth control and essential health screenings that they need. We've got state representatives in Idaho, which is right across the border from my state of Washington, who have said they're going to now hold a hearing on banning forms of birth control. A Louisiana state legislature just passed a law out of committee that would outlaw forms of birth control. And right here in Congress, we've got sitting Republican senators talking about how Griswold versus Connecticut, which established the right to birth control 57 years ago, to the day, was wrongly decided. That is absolutely outrageous, and Democrats are fighting back. We are using every lever we have to protect our most fundamental reproductive rights. And that includes fighting to protect every single patient's ability to get the birth control they need without being forced to pay out of pocket or jump through ridiculous and medically unnecessary hoops. Our Affordability is Access Act will make sure that every patient can easily find and afford the birth control they need to stay healthy and plan a family on their own terms. Right now, patients need a prescription from their doctor in order to get the birth control they need. That is likely to change in the future because birth control should be available to patients over the counter, and it should be fully covered by insurance. So what our bill does is make sure that once the FDA determines that an over-the-counter birth control option is safe for use, it approves that birth control option without delay. And of course, it's not enough to just make over-the-counter birth control option available to patients. They need to be able to afford that birth control option as well. So our bill requires that insurers to fully cover over-the-counter birth control options that are approved by the FDA, just as they are now required to cover existing birth control options, because birth control is essential healthcare. It's healthcare that allows women to have full control of their own reproductive lives, or their own economic livelihood, or their own body. So even as Republicans attempt to drag us backwards and take away people's birth control and control their bodies, Democrats are fighting to make birth control accessible and affordable. Our bill will finally free the pill so women can find and afford the birth control they need without extra costs, without extra hoops, and without politicians interfering. Women in this country should be able to make their own healthcare decisions. That's exactly what we are fighting for. I'm really glad that we are reintroducing this really critical legislation with my colleagues today, and I'm really excited to be joined by Congresswoman Pressley, who will speak to you now. She's been an amazing advocate. Thank you.
Thank you so much, Chairwoman Murray. Grateful for your partnership and your steadfast leadership in this fight to affirm and protect reproductive health care, really as the fundamental human right that it is. And of course, I want to join you and also thanking our co-leads, Representatives Ocasio-Cortez, Bera, Senators Hirono and Cortez Masto, for their leadership and commitment to this work. Here's the thing. It is really critical that we are using every policy lever at our disposal to protect and expand access to the full spectrum of reproductive health care services while we continue to be in the midst of these unprecedented attacks on abortion rights and access. We have to leverage every policy tool available to us at our disposal in order to ensure that there is access to the full spectrum of reproductive health care services, including over-the-counter birth control for all. Now, while access to contraception is in no way a substitute for abortion care, we know that birth control plays a critical role in supporting people as they exercise their reproductive freedom, the power to protect one's health, the power to plan if, when, and how to start or grow a family, the power to determine one's future and thrive, free from coercion and interference. But despite contraception being safe and effective, millions still struggle to access contraceptive services, particularly Black, Brown, Indigenous people of color, low-income people, disabled folks, and our immigrant neighbors. Now, while the Affordable Care Act mandates coverage of contraception, 1 in 3 women of reproductive age continue to face obstacles to prescription birth control, while millions continue to lack insurance coverage altogether. More than 19 million low-income women live in contraceptive deserts where they lack access to a health center offering a full range of birth control methods. So it is no coincidence that the very same communities disproportionately impacted by harmful abortion bans are the very same folks most likely to face these systemic challenges in accessing contraception care. And these barriers in contraceptive coercion are not new. Black, Brown, and disabled folks in particular have suffered a long history of forced sterilization and experimentation that has robbed us of our bodily autonomy and reproductive freedom. No more. The ACA will ensure, the Affordable Access Act will ensure that over-the-counter birth control will be available without a prescription and covered by insurance for anyone who needs it. It is long past time that we get this done. The far-right majority of the Supreme Court and their anti-abortion allies across the country, they're not going to stop dismantling Roe. They want to see it fall. We have extreme legislators in Missouri, Louisiana, and Arizona who've already begun their efforts to undermine access to contraception, including Plan B and even IUDs. So we can't stand back and watch as these extreme lawmakers attempt to stigmatize birth control and yet another effort to control our bodies. And as Senator Murray spoke to, 57 years ago today, the Supreme Court established for the first time ever, through the landmark Griswold versus Connecticut case, the constitutional right to privacy regarding reproductive health decisions, a case that eventually paved the way for safe and legal abortion care under Roe v. Wade. On this anniversary of the Griswold case, we declare that we will not go back. We will not go back to the days where contraception and abortion care were criminalized and stigmatized. And we will not let our children grow up in a world where they have less rights than we do. Our work to protect reproductive freedom and bodily autonomy is far finished. Reproductive rights are human rights, and we will continue to fight to ensure that it stays that way. And with that, I will turn it over to Dr. Reagan McDonald Mosley, CEO of Power to Decide.
Thank you so much, Congresswoman Pressley, and thank you for inviting me here to speak today. My name is Dr. Reagan McDonald Mosley. I'm the Chief Executive Officer of Power to Decide, a nonprofit that works to improve reproductive well-being for all. And as Congresswoman Pressley said so astutely, we work to ensure that all people have the power to decide if, when, and under what circumstances to get pregnant and have a child. I'm also a practicing OBGYN with nearly 20 years of experience providing the full range of reproductive health services and care. And I've spent my entire career serving people in communities that have been historically marginalized and underserved. Unfortunately, that means I've had far too much experience working with patients struggling with cost and other barriers that unjustly limit their birth control options available to them. It should never be the case that a price tag or lack of availability of services makes birth control out of reach. However, millions of people across the country struggle to access basic health services like contraception care because they live in areas without reasonable access to a health center or clinic. The Affordability is Access Act would help put birth control within reach of the 19 million women in our nation who currently live in contraceptive deserts, and the 1.2 million women who live in a county without a single health center that provides contraception services. Removing barriers to safe and effective birth control is an urgent reproductive health access and equity issue. That's especially true for people in rural communities and communities of color who already face systemic roadblocks to getting the healthcare that they need and deserve. The Affordability is Access Act builds on the promise of the Affordable Care Act, which requires health plans to cover the full range of birth control with no out-of-pocket costs by clarifying that coverage applies to over-the-counter contraception without requiring a prescription now and in the future. By expanding access to contraception, we're supporting everyone's right to optimize their health and determine their own future. Thank you so much to Senator Murray, Congresswoman Pressley, and to all of the co-sponsors of the Affordability is Access for your work ensuring that everyone has the opportunity to protect their reproductive well-being now and in the future. It's my pleasure to pass it off to Rose, a youth council member for Free the Pill.
Thank you so much, Dr. Reagan. As mentioned, my name is Rose Schnabel, and I am a youth activist with Advocates for Youth as a part of the Free the Pill Council. And in the Free the Pill Council, we're a group of about a dozen high school and college students across the country that are fighting to make over-the-counter birth control a reality, covered by insurance and without an age limit. When I've talked to people in my hometown, at my university, there's incredibly vocal support about having an over-the-counter birth control option. Advocates for Youth has a story collecting campaign, and I've read through dozens of stories that all have the same message and that resonate with my own experience, which is once someone has made the decision to take charge of their reproductive health and to access birth control, there should be nothing in their way that's preventing them from doing that. When I was trying to access the pill for the first time, I couldn't get away from school and activities to go to the doctor for a prescription. Then I couldn't find a provider that accepted my insurance. And even once I found one, I had to beg my friends for a ride because I didn't have a car on campus. So all these things delayed my access to the pill by 3 or 4 months. And that should never be the case for anyone, especially in those communities where it's even harder to get a prescription. So having a pill over the counter and covered by insurance would be of huge benefit to me and young people across the country like me. It would be accessible and I could just pick it up on the way back from classes. And since it is something that I foresee myself taking for maybe decades, as many others do, it is crucial that it's covered by insurance because as a young person at school, I don't have time for too many jobs outside of that. So I wouldn't be able to sustain a prescription that I have to pay for every month for years. Again, I'm very grateful for Senator Murray and Congresswoman Pressley for the Affordability is Access Act. I know that it would make a huge difference in the lives of young people, and it would finally grant us that little bit of bodily autonomy that has been slowly taken away from us.